just to get it clear right now,
Yeah.
you've got your super accurate scribing AI available to all NHS GPs free.
For free. Yep.
Hi guys, we're back. I'm Dr. Amar Ahmed. I'm a GP partner at Wilmslow Health Tech past 24 years.
I'm Dr. Fari Ahmed, another partner at Wilmslow Health Tech, and we're here to talk about another
AI scribing tool, and we're joined by Tom.
Hi everyone. Hi guys. Thank you.
Hi Tom.
Tom, why don't you introduce yourself and Heidi?
Yeah, for sure. So hi everyone. I'm Dr. Tom. So doctor by background. I was last a vascular surgery registrar in Australia, practicing clinically. So might hear my accent during the session. But yeah, I founded Heidi from like an obsession I had with AI for a long time. So we were playing with all sorts of tools from like 2015 through till 2019 when some of these models that could write got really good. And started the company with a few friends that I've met along the journey in 2019, and we've been working on it ever since. We worked mainly in Australia in GP actually for like the first 2 years of the company, and then started launching the product internationally in the last, say, 6 months to a year. And excited to tell you more about it.
Brilliant. Okay. And so, again, one of the first things that everyone always asks us about this kind of software is the security and the compliance side. So we always tackle that first. Why don't you tell us a little bit about how safe it is, or otherwise, of using Heidi in the NHS?
Yeah, of course. Yes, I think that's one advantage we have compared to maybe some companies that have just appeared. So like obviously I know being a clinician that it's just like a must-have thing. You know, the conversation between you and a patient is like the most sensitive thing that you could possibly store. So there's different elements. So the first one I think, which is more important than everything, is actually real security. So it's like, do you have some external audit of like your system and like a third-party system that looks into your software, tries to like white hat hack you? So we do that. So we have ISO 27K certification, which is pretty much like industry standard, like as high as you can get, proving. So we have to submit to an auditor, like the structure of our software. All our staff have to be trained. Things like we can't just let anyone into the building. We have to have ID tags, like all this kind of stuff. So yes, that's step one. So like, is your software secure from threats? So yes, to every extent we can, we try to make the software secure. Then the second thing is more about, like healthcare data compliance. How do you store and treat it? How do you protect patient privacy? All these things. So we take that really seriously. So we've done pretty much all of the NHS standards. So we're starting to sell into some NHS hospitals. And we know, like, depending on the clinic or which trust you're in, there might be slightly different behaviors. So we can do like data processing agreements, and basically like if you want to use Heidi and you're unsure, just message us and we can help you figure out the process there. But it includes all sorts of things. So like we don't do any secondary commercialization of data, like we don't mine the data, we don't sell it. We can't access like any of the identifiable data that you create on Heidi. Actually makes it hard to troubleshoot sometimes because people will say, oh, can you just go into my session and like fix it? And we go, no, we actually can't. Like we can try to regenerate and like do a couple of things like without seeing what's there, but otherwise we're pretty much locked out of it, which I think is a good thing. And what else? Like we've got GDPR. We've across all these different countries done all the different compliance standards that we need to.
DTAC as well.
DTAC, yeah. All I know about the NHS is there's a lot of different things that start with D. It's all data or digital. Yeah.
Are you being used in? Are you able to say which NHS trusts you're being used in right now?
Yeah. So I think at the moment, like last I saw, we've got like a few thousand clinicians in the UK using Heidi. Like I can talk through. So some of these are still work in progress, but like in Central London Trust, in East London, in Manchester. All of these places have like different parts of the trust that are either trialing it or signing on. And then we also have quite a few private practice. So folks at like, your OneWell, Vex, and people like that are trying Heidi out. Because I think one thing that's underrated about these tools is how much it has an impact on patient care, because you can like give them focus, not have to like do the computer at the same time. So yeah, it wasn't what we expected, but a lot of people want to do it just for the patient care improvement,
Absolutely.
even ignoring the efficiency, which is obviously huge. Yep.
Yeah. Okay.
Do you know where the servers are based? So where's this information held?
Yeah, so when you sign up to Heidi, based on which country you pick, so if you pick United Kingdom, then all of the data is stored in the UK and in compliant servers according to all those standards. And yeah, same for other countries. So basically, it's all based on where you pick when you use.
Okay.
Okay. And do you record consultations?
So there's no actual like audio recording captured. It's just like a transcription that's being made. And then that transcript is the thing that gets stored. And we give you options about what you want to do. So whether you want it automatically deleted after a day or whether you want to retain them. And we obviously have to store them ourselves because that makes the service work. But we give you the option to decide like how you want, whether you want to delete them or not.
Okay.
Yeah.
So when you said it makes the service work, what do you mean?
Just that like if you want to come back tomorrow and regenerate a note or create a letter or something like that, we need to have that transcript for us to be able to do that. But we won't store it indefinitely. And like I said, we don't use it ourselves.
And you're not using it to train the model at all?
So we don't use any identifiable data for training. We do, in our terms, have aggregated DID data for improving the service, which I think is important because basically you've got two choices. Either you don't look at any data ever, which basically just means you're not doing any governance or any QA or any improvement. Like you're just you're basically just giving ChatGPT to doctors and calling it your own product, which I actually think is irresponsible. It's better to have some usage, but like really stringent DID and like aggregated always. So you never actually, like an example is I can give you analytics about like how long sessions are or which types of clinicians like use it more often. Whereas if we don't have that, then we can't give you any info. So I think that's important, but obviously like some organizations, if they want to opt out of it, they can. It's kind of up to them, but it just allows us to improve the service. So we can find, like, let's say maybe GPs in one trust seem to not like it very much, and it might be to do with their maybe their accent or the local regional accent's different to the things we've practiced before, so we need to make some changes. Anyway, so I think it's important to have some.
Understood you quite well.
What is you implying? Honestly.
So just to go back to that then, you are using some of the data that's recorded anonymously, anonymized data to train the model and to get analytics out of it.
Correct.
Is that right?
Yeah. So like we've never used it to train any model at the moment. It's mostly just to try to improve the product. So find gaps, problems, more like analytics on how it's used.
And you can opt out on that if you're quite sensitive to that.
Yeah.
Okay.
Yeah. And then the transcript, the stuff you generate, you can choose how long Heidi holds on to it.
Correct. So in current Heidi, you can just delete it. So when you delete it, it's deleted from your account and our side. So we're not storing it. In the next version, which is what I'm going to show you guys in the showcase, because it's just going out to users, you can just get automatically. So you can have like 1 day, 7 days, 3 weeks, however long. It's interesting, like it's quite polarized, I would say. So some clinicians really don't want the transcripts and they just want everything deleted. Others actually like the idea of as long as we're compliant with how we store it, they like the idea of having like a full memory of everything they did. So they can go back and find like something that they said did. Or even in the case where maybe there is some legal case brought against them, they actually have a whole transcript of exactly what they did. So if they did a good job, now they've got all this evidence of what they, like the great job they did. So it kind of plays in both directions. Like I can see both cases of whether it's good or bad, but it's not up to us to decide. We just put it in the hands of the clinicians. Yeah.
And just out of interest, we've been asked quite a lot as well. Do your clinicians actually inform patients that it's there and transcribing?
We always suggest people should do that. Also, again, in new version, there'll be a way to turn on consent, just so you remind to record it each time. it's quite hard to give general advice because it's a bit of a gray area, honestly. Like it's not, there's no clear, especially because there's no, if it's voice recording, that's different. Like if you're recording patient identifiable voice, that's different. But if it's just a transcript that's being created, especially because that transcript may or may not be re-identifiable, it's a bit of a gray area. But I just think if you're recording someone for any purpose, you should just tell them. And we have like consent examples and examples of how to say it to patients, but usually something along the lines of like, I use Heidi, it's a transcription tool, it helps me write my notes. There's no recording stored, like no one can access except me. Are you okay with that? If they say yes or no, that's fine. It's like, and you can also chuck in like, the benefit is I can just focus on you in the visit. Like I don't have to do the computer. I can spend the time.
Completely true. Absolutely. Okay. I don't make any excuses for concentrating on that bit and spending a bit of time on that.
That's right.
But I think it's really important. Why don't we jump into the actual showcase? Show us what you've got, Tom.
Yeah, let's do it. All right, so this is Heidi. Let me know when you can see it.
We can see it.
Yeah, we can see you.
Excellent. So this is Heidi in a web browser. So the way Heidi works today, you can just power it up in a web browser on your phone or on your desktop. Obviously, wherever you have a microphone. So sometimes if you're on the go, people will commonly use their phone. But if they're in a clinic setting where it's like a setup and they've got a mic, most often they'll use it on their desktop. Yeah, this is the slightly new version, but by the time this video goes out, this will be broadly accessible to everyone. So there's a couple of different ways you can start a session.
I've been using this.
Have you? Yeah. Okay, stop showing off.
It's early.
Stop showing off.
So dictation is where you do like a sort of verbatim style dictation of what you want. So you say, hi, Dr. Thomas Kelly, comma, new line, I referred patient to you for a cardiac echocardiogram because I'm concerned about a possible congenital heart defect, perhaps HOCM. I hear an audible systolic murmur, full stop, new line. Thank you for taking him under your care, full stop, new line. Kind regards, Dr. Schwammer. Okay. Click stop. And so this is that more like verbatim kind of thing. So we're going to try to turn that just dictated output into a letter, and we try to kind of guess based on the transcript what we think you want. So you can see, hi, Dr. Thomas Kelly, and like it's obviously not a great letter. You can tell it's not. I haven't done them in a while, but you can see the output there.
One of my letters.
I think it's actually longer than one of your letters.
Yeah, exactly. It's extremely detailed. And then kind of like an interesting thing that we do with Heidi is that we let you, there's a high degree of customizability in how Heidi writes. So for example, let's say I wanted to change this or turn it into a letter or something else. There's always this create document button. So what this does is it'll take that dictation that I've done and then apply it in another setting. So I've got all these templates that I've saved, and I can jump into one, and you can see here, I've got a template here that's for a referral letter. And it's got some sort of almost like a macro. It's got some pre-canned information and statements that make my letter look a bit more professional. So if I just click save and use, oh no, I've got to make myself a pro. Give me 1 second.
No perks for the job, eh?
So people can use this free, can't they? For 7 days.
Actually, why don't I'll just, yeah. So yeah, all of this, what you see is free. So this is actually a good way to show you. So Heidi's actually free to use. The limited part is creating documents. So that's literally what I'm showing you right now. So I'm just gonna start a trial. Let's just do this. I'll just cancel it on the other side. And yeah, so it's free to generate notes. You can do dictation for free. We basically charge for the custom templates. So if you have lots of specific kinds of documents or things that you really want to create that require like AI prompts, or that's how sort of our business model. But you can get all the benefit of just like creating the initial note for free.
And and the free version, is that less capable than the pro version in terms of scribing your notes?
No, so for the note itself, it's actually pretty much identical. The only thing is, in scenarios where we have lots of sessions happening, we do prioritize the pro users. So in busy, like middle of the day, sometimes pro will be a bit faster than free, but we don't like intentionally slow it down or anything. It's literally just the same thing. Like you get the whole visit, you know, like let's say this is an example I did just before, patient presenting with acute right septic right knee with like infective symptoms, and yeah, it just works. So I've been on free up to this point. I only just realized I didn't have pro. Yeah, so anyway, the creating of documents, I was going to show you these letters. So if I just click save and use, now it'll pop out another tab and go ahead and generate based on that template. And you can see, so I haven't put any patient details in, so it hasn't got the patient's full name. But you can see it's including the sections that I had. So if I had mentioned the medicines or mentioned the patient's name, it would have included it in the section. So that's the dictation mode. People use that for letters, notes, reports, where like it's very structured. You know what you want to input. So like we have an organization in the UK who does a lot of ADHD assessments. So they have these like huge templates with every little field of like the assessment that I don't even know, and then they'll go ahead and dictate it, and it'll just fill into that report for them. All right.
Just out of interest for that one, let's say you're doing that, you've got that letter template there. You've got eMish integrations, haven't you? Or have you?
So we're nearly there. So we're through their compliance process, just in the like kind of building phase with them. And then we're going to go through all the main ones. So system one.
And that will pull through all the current medications directly into the letter.
Yeah. So ideally, yes. So usually the way it works, integrations, we start off simple. So showing you like your schedule, creating demographic data. So reading demographics is the bit. But definitely we see a world where we read like historical notes. So if you do like let's say a progress report on a chronic issue, like someone who's had rheumatoid arthritis for the longest time and you're seeing them again, just an annual check-in, then obviously it's really useful to have some of the historical information, because then Heidi's not having to guess the history when we write the note. There is a way to already kind of do that. So I'll just show you this additions area. So when you create a new session like this, you can just paste any relevant context here. So like, let's say the last time I saw Tom, I want to copy this in, and now that's context that Heidi has. And if I start the session and we did a visit about how I went to the cardiologist, it will include this referral in the note, like as context. And you can also use this during recordings. If I click start, so you can also use this during recordings to report things that you're seeing. So seeing like withdrawn things you're not going to say out loud. It's kind of up to you how to use it. We'll skip that one for now. And the main way of using it, like most clinicians sort of transcribe their visit, so they'll start the recording. A couple of things as well, we also have lots of languages. So if you're going to do a consult mostly in another language, even if there's a bit of mixing between like, let's say, because I speak Spanish, for example, so let's say, it's like a bit of Spanglish in the middle, it should still work pretty well. And you can also upload recordings. So let's say you're in like an offline environment and you're using like voice memos or something, you can upload the file and Heidi will transcribe as well. Or like maybe use a dictaphone or something you want to upload and create letters, you can.
So just a thing, like, so if you did a consultation, like I had one in Urdu, would the transcription be in English?
Yes. So
it would translate and then transcribe. Okay, well, that would be helpful. Yeah.
So we give you options. So by default, we output in English just because we're assuming most terms are in English. The only thing is when you use another language, we do assume that you speak both. So because it's important. Like, we're not a translation tool, you know, we're not like a medical translation tool, but we are happy to write it in another language as long as you speak both. So you can vet that. Yeah, and then the main way people use Heidi is just transcribing a whole visit. And at the end of your visit, you'll get something written out like this. So I'll just regenerate it. So this is a case of someone who injured their thumb 2 to 3 months ago playing basketball and probably has some sort of like malunion kind of fracture that hasn't healed properly. And if I click just regenerate, Heidi will take a little bit of time because it was sort of like a 5-minute visit. So it's going to go ahead and write out a really super detailed, because I've chosen super detailed as my voice. It's going to write out super detailed. No,
so there's one that's called Goldilocks, which is not too long, not too short, I presume.
Yeah.
Okay.
Just right.
Yeah, exactly. So yes, I can talk through them. So brief was definitely built for my surgical days in mind. So it's meant to be like, you know, very like use clinical shorthand, very condensed, so we can just use it. So it should say things like, you know, like 3/7 instead of 3 days. It won't have like patient quotes. It'll just be like purely
much easier to read, isn't it?
Yeah. Like, so when I use it, I use brief. So I like it condensed because it's like information rich, but no extra.
No both.
Goldilocks is meant to be like where we let Heidi decide where you need detail versus not. So we try, like, it doesn't work perfectly. We're still trying to improve it. But like, let's say if it's a psych visit and you have Goldilocks on, it should include more patient information in their own words, like exactly what they said. And then detailed is like starting to get a bit detailed, some patient quotes, but not like crazy. And then super detailed is like you want like almost a verbatim summary. Every point that is in the note has an associated like piece of evidence of like what exactly was said or discussed, which is really important for mostly psychology and mental health cases where you just like also part of it is like protecting yourself, just doing like an amazing document. You just want all the detail. But Goldilocks I think is like hopefully just right for most people.
So after it's recorded it, you can adjust that. Once
exactly.
That's good. Yeah. Because sometimes it's only afterwards you think, God, I should have actually caught everything there.
Exactly. And that's what I was mentioning about us needing to store the transcript in that compliant way, because that way you can come back. Or let's say someone asks you to create something from this visit, you can always just come back and create something else. So you can say, like, let's say I, write a referral letter to ortho, and I know there's a typo, but I'm just going to leave it. And you can just click, or you just do like Command Enter, and then even without a template, Heidi will do its best to just try to write in one shot what you want. It doesn't work, so maybe like this isn't quite what I want. So maybe I use Heidi here to say, can you rewrite the letter, but more like full sentences and narrative, less like a note, no dot points.
So what's it using? Is it Amazon or Microsoft or?
So we actually depends on your settings, what we use. Actually, so we found that the best models at the moment is coming from Claude and Anthropic. So it's Anthropic is like the OpenAI in this case, but their model is just amazing. Like, it just writes so well. And we still, again, same thing, like we have all of the compliance with them to make sure there's like no retention, no training, no anything else. But it works really well, as you can see, like it followed my instruction. This is the one that it did originally, and then now it's gone ahead and written it out in the more like lettery kind of way. And I didn't even have to build a template to do this, which is kind of amazing. So that's the other feature which I zoomed through. But templates, you can create kind of anything you can imagine, and within templates you can write instructions and placeholders, but we have lots of guides and things which we can share on this. Don't want to get too in the weeds, but you can see like, likely diagnosis, but only if explicitly mentioned. And so you can change it to say like,
this is fully customizable.
Yeah.
Yeah, you can change this to say like we have a user who is a urologist and he has a prostate cancer surveillance note. And what he does is he'll say in the historical info at the top, he'll put like their previous PSA, their Gleason score, and ask Heidi to score based on what he puts in additions. So it's very configurable. Like it's up kind of, it's definitely a bit of a learning curve to get Heidi to do exactly what you want. But to start off with, like most people just use the templates we built, don't think hard about it, try it. And then if you're liking it, then of course, yeah, you can get crazy. You can get it to write one line in one language and one line in another language, like it's up to you what you want. The other thing as well, which we're quite excited about, is this Ask Heidi bar. So it's kind of like that chat with AI experience that some people have had, but with the benefit of Heidi having the transcript. And so there's lots of things you can use this for. So like I said, you can use it on a tab to edit. So you can say, write it in a different way or rewrite it. You can ask it for billing codes, give me ICD-10 codes. Let's visit. Don't even need to write that, but I just feel like being polite sometimes. Yeah, and now I've got my ICD-10 codes, so I can just add that to my note. And like maybe they're not quite exactly what I want, or I could say, summarize this in the ISBAR format. Let's say you're doing like a handover or something like that. And so we like it as sort of like an open-ended way to use AI. And
does it tell you about the latest NICE guidance or that kind of stuff? It does.
Yes. So at the moment we try to keep it out of management and diagnosis land, just because when we do that, so usually Heidi will like try to stop you doing it, or say like Heidi's not for management and diagnosis, but like here's what I found on a website or something like that. But we definitely want to do it. So we want to make it so that you as a clinician maybe go into settings, maybe into your session settings, and like set up which resources, like you just give us the resources that you use already. And then Heidi almost like browses those resources for you, kind of like how ChatGPT does it to try to find like sourced information.
Because that's even local
so like you can pick your own,